I'm Sonia Brar. I'm a general OBGYN associated with Mount Sinai West. Yeah, so there are so many options available out there today for contraception that everybody can find something that works for them. I like to divide them into groups of three. Hormone-free, those that contain estrogen and progestin, which is the type of progesterone, and then progesterone only. So for hormone-free, you have the options of condoms that you use every time, the copper IUD called the Paragard that you can place once and it's good for up to 12 years, and surgical sterilization, which for women is surgery on your fallopian tubes, and if you have a male partner, for a vasectomy. The contraception that contains estrogen and progestins could be anything from pills that you take every day, a patch that you change once a week, and a vaginal ring that you insert every 3 weeks. And then for progestin only, you have a lot of options. There's, again, pills you take every day. There's an injection that you can have every 3 months. And there's IUDs. There's 4 types of IUDs that have progestin in them. So generally, no, it won't cause weight gain. Studies have shown that women gain the same amount of weight over a long period of time, whether they're on birth control or not. Some women have reported weight gain with the progestin injection called Depo-Provera, but clinically it's not very significant. It's less than 5 pounds. No, that's such an old school way of thinking. Anybody can get an IUD, whether you're an adolescent or whether you're a woman who hasn't had children yet. Complications overall from IUDs are really rare. And, overall, they're really rare for young women and adolescents as well. One of the progestin IUDs called the Skyla was actually made for this subgroup of women. It's smaller, it has a less amount of hormone, and is technically easier to insert. But young women and adolescents are able to get any type of IUD. They don't have to just get that one. Yes, you can. So the only time you're limited in your contraceptive option with migraines is if you have migraines with auras. And auras are a type of neurological symptom that you can have associated with them. And if you do have migraine with auras, then you would pick from the progestin only category for contraception, which still includes a ton of options. As we talked about, the pills, the injection, the IUD. But if you do have migraines, talk to your doctor so you can find birth control that works safely for you. Yes, definitely. So hormonal birth control has those 2 hormones, estrogen and progestins, or just progestin only, and they have been proven to help decrease the amount of cramping that you get with your periods, and they lighten the blood flow that you have with your periods, as well as shorten the amount of days that you bleed during your period. Often with birth control, you can stop getting periods altogether, which is a great side effect of it. And it's totally safe not to get your period when you're taking a hormonal contraceptive. It's only not safe when you aren't getting your period and you're not taking any hormones. So the only form of contraception that will protect you against STDs is condoms. So even though you are using another form of contraception, such as the hormonal contraception, you may need to keep in mind that you may need to use condoms as well, depending on your situation. So overall, if you are sexually active and you're not planning to get pregnant, definitely look into starting some sort of birth control. There are so many options today that are safe and effective that you'll definitely find one that works for you.